Hi, I'm Dr. Sherman Leis. I'm a graduate of Rutgers University, the State University of New Jersey, and I went to medical school at the Philadelphia College of Osteopathic Medicine. Following that, I took an internship for 1 year in Detroit, and then I had 4 years of general surgery at Metropolitan Hospital in Philadelphia and at the Albert Einstein Medical Center in Philadelphia. Following that, I was awarded a fellowship in plastic surgery, and I went to Europe for 2.5 years. I spent a year in Paris with some well-known surgeons, Professor Claude Dufourmentel and Dr. Paul Tessier. And then I went to Sweden at the University of Lund Hospital in Malmo, a large 2,000-bed hospital as part of the university. And I was there for a year and a half with Professor Carl Eric Hugerman and his staff. And then I came back to the United States in 1974 and started practice and teaching at one of the local medical schools. One of my goals in becoming a plastic surgeon was to not only have a nice plastic surgical practice, and that's why I spent a lot of years training to become fully trained in general surgery and in plastic and reconstructive surgery, because before the plastic surgery I had full training and I'm board certified in both general surgery and in plastic and reconstructive surgery. But one of my goals was always to be able to train young surgeons. And so when I returned to the United States, I developed my practice. I started teaching at the local medical school, the PCOM in Philadelphia. And within a few years, I started training preceptors. People came from around the United States to work with me. And within very few years, I applied to our College of Surgeons and was given a permission to start a residency training program. And that residencies are programs where doctors become specialists. And it started about 1990 or 1991. We began the plastic surgery residency. And since then, I think I've trained more than 60 plastic and reconstructive surgeons who are scattered all around the United States. And that's a source of great pride to me to know that I was helped by some important people in my life, and I was then in a position to help other people develop a career, and I was able to do that. It gives me a lot of pleasure. I have here a unique resource for transgender people. It was my concept to develop a sort of a one-way stop for transgender people to be able to satisfy all their needs in transitioning. From the beginning to the very end, someone could come here knowing very little about the transitioning process and going right through the whole process. And when I began this concept of we call it the Philadelphia Center for Transgender Surgery, we put together a large group of specialists, endocrinologists, to help our patients effectively and safely take hormones. It's not good to just mail away hormones and just take what your friend takes and hope that you're going to be all right, because you could damage your adrenal glands, you could damage your pituitary, you could damage your kidneys, and you can get into very serious medical trouble. You could go into liver failure or kidney failure by not taking the right level of hormones. So we have to make sure that those hormone levels are both effective so that they do their job, and also safe, that you don't get into trouble. So we have 4 or 5 endocrinologists and some other physicians too who have a lot of experience taking care of the hormone requirements of transgender people. We have OBGYN specialists, because sometimes we need to do a hysterectomy at the same time as a phalloplasty, for example, in a female-to-male transgender person. So it's good to have some gynecologic surgeons who can do that work. We have general surgeons in case someone developed a complication with general surgery, somewhere with their intestinal tract. We have urologists on our team. All people in the Philadelphia area and beyond who can help us with potential problems or complications of transgender surgery, with the idea that we never have complications, but any surgery has complications. We have a number of social workers and psychologists, PhD psychologists and psychiatrists who can help evaluate a trans patient and give them therapy if they need it. A lot of trans people are depressed. They've been treated pretty badly most of their lives. And so sometimes they need some help getting through some of the problems that are thrown at our population. And also for clearance for surgery. I don't require specific clearance for facial feminization procedures or for top surgery, breast surgery. But I like to be sure before we do the bottom surgery, the genital reassignment, that a person is mentally healthy and stable and understands the ramifications of what they're doing so that we can do it safely and wind up with a happy patient who's going to be satisfied and happy with themselves and with their friends and family for the rest of their lives. It won't do anyone any good to rush into a procedure because someone decided last week or 2 weeks ago they want to be the opposite gender to which their body was born into, and all of a sudden, and after we do it, shortly afterward, they become unhappy and say, oh, this was a mistake. Well, I never want to hear that. So far, I haven't seen that happen. I've never had a patient feel as though they made a mistake. I did have one patient, I must say, that did something funny. They woke up after surgery, and all of a sudden, immediately after surgery, an M to F patient, a male to female patient, the first words out of her mouth were, I changed my mind, put it back. And he started laughing hysterically. And everybody laughed along with it, but then she said, I always wanted to say that, and then she went back to sleep again. It was just a funny thing, because that would be a horrible thing for me to hear, that we made a mistake and we did the wrong operation on the wrong person. But we have a large number. We have fashion coordinators and hairdressers. As a matter of fact, after surgery, I don't know if any other surgeon does this, but I have a makeup and hair specialist. She's a master hair cutter. Come in here the week after surgery and give my patients a free hairdo, hair color, haircut, hair styling, makeup, fix their eyebrows, do manicure, and get them in top shape before they leave here to go home. I changed my mind, put it back.